Calling all ninjas. Calling all ninjas. It's time for Lyme Ninja Radio.
Hello, I'm so glad you're here on Lyme Ninja Radio Live. This is episode number 267, and we've got a little something special for you tonight. But before we get into that, let me introduce our show producer, my show producer, Aurora.
Hello, good to see you. Hi, Paula. You may have noticed things that are a little different here at Lyme Ninja Radio. We're recording the shows now on Facebook Live. It's a little bit more interactive and you get to ask questions.
Exactly. And what we're going to do tonight is we're going to talk about Lyme disease and the coronavirus, because everybody's talking about the coronavirus, it seems. So we thought we'd get into the Act 2 and see if we can sort out a strategy for you and to give you some information. So what makes sense for you? So I listened in to the CDC's website today. They had a conference for reporters trying to get everything to make sense. And my biggest takeaway was that it just like Lyme disease, it's a personal decision and it depends on what's going on in your area. So that said, we're going to help you sort through that and develop a bit of a plan so you can protect yourself from this virus and develop a plan that takes into account your kind of, what do I want to say, how you feel about it, right? Some people are like, completely blasé. Like, I'm not worried about that. Other people like Rusty the dog who's barking in the background there. You're going to have to let him in. Yeah, or put yourself on mute there.
Yeah, hold on one second.
All right, so the fun of going live. But anyway, so that's the point. And depending on where you live and your level of sickness, you might need to be very concerned about this virus or maybe not so concerned. And that's really a decision that you can make for yourself. And really, you can't rely on other people, or especially things like Facebook, even though we're on Facebook here, and the other internet. There's a lot of hype out there. There's a lot of panic that's starting to, and there's a lot of good information. So we're going to help you sort through those things. So hi, Paula. Thanks for checking in. Hi, Christine. It's good to see you again. And Aurora has left, and you get to see the menagerie that is our house right here. So I'm going to take her off the screen there for a second. So every week on our podcast, we have people tune in from all over the world. And I'm going to give you just a rundown of who tuned in, where they were from, not who, but where people tuned in from last week. And we had people from Dublin, Ireland, Atlanta, San Francisco, New Albany, Ohio. I don't know where that is. Chicago, Illinois, New York, Benton Harbor, Michigan, Los Angeles, California, Santiago, Chile. And once again, we've had the most listens all the way from Paris, France, which is kind of cool. We're not sure what's going on there in Paris, but apparently they really have developed a taste for Lyme Ninja Radio. And hi, Tom. Oh, he says hello to Paula. That's awesome. So if you could take a moment and just let us know where you're from, we'd love to add to the list of where people are from. So just if you're willing to share the information, the town that's closest to you, it would be cool. We're in Deansboro, New York. I like to say way upstate New York. Right, Aurora?
Cow country, right?
Definitely cow country. So just go ahead, type in the chat box there where you're from and let us know. So Kimberly's here from Akron, Ohio. Hello, Kimberly. Thanks for tuning in. Appreciate you contributing. Now, one of the things I want to say as people are typing in here, and I move closer to the camera. So in listening to the CDC's press conference today, what became apparent is really there are kind of three levels of isolation and that's going on. And one is kind of people's own withdrawing, kind of social withdrawal or keeping distance from each other. And to be effective, you need to be 6 feet away. And I think that's kind of like a sneeze radius type thing. And there is some danger for picking up the virus from contaminated surfaces, but the virus itself doesn't live very long on contaminated surfaces. So it's not like hepatitis where that virus can live for weeks, literally on a table surface. So if you wipe off a surface with a disinfectant, you should be fine. Or if you avoid touching things, you should also be fine there. But to stay away from people, 6 feet is a long way, especially if you're in a city. So it's almost impossible, right? So that's number one. And then also learn the difference between quarantine and isolation. So quarantine is when you hear of somebody getting quarantined, it means they don't have the disease yet, but they're being isolated to protect people around them. So that's what a definition of a quarantine is. When you hear that term from the experts, a quarantine means that somebody isn't sick yet, but it's precautionary measure. And isolation is when they are sick, and then that's the whole, they've got the suits on and all those protective measures that happen, or sometimes they just send people home. So really at this point, what the experts are saying, your best defense against this virus is to isolate yourself.
Yeah. Now, I have a quick question, kind of pivoting over.
Yep. Hold on to that because I just want to say hello to everybody else who's checked in with us. So Jan from Scranton, PA, not too far from us. And are you going to come up to the Southern Tier Lyme Conference? I'm going to be the MC for that. So Jean, if you're up there, please go ahead and say hello when I'm going to be there. And hi, Kimberly. We love you too. Thanks for loving our show. And Tom, local. Excellent. We haven't met yet, Tom. Maybe you'll come to the next local meetup that we have over there. Right. And Paul Stern is just a couple of hills over. Yes, in central New York, in Frankfurt. That's awesome. And Lymies are used to isolation. Isn't that the truth? So Aurora, what's your question? Let's get us started. So the other thing, if you'll, I'm sorry to interrupt again, but that seemed to be what I'm doing right now. So what we can do is if you have specific questions about here as we begin to kind of roll out some of the information we've been learning about this, then go ahead and type those also in the comment section, and then we'll get to them as the show goes on. All right, Aurora, what is you get us going here? What's your first question? So
my question is, what is the CDC's, what are they saying about people who are immune compromised? Because, with Lyme disease, you're basically dealing with an autoimmune or a compromised immune system as it is. So what are they saying about people who need to take that into account?
So what they're saying is people at risk need to be more careful, right? Common sense. And they also went as far to say, what does being careful meant? And the answer was, well, it depends. And as somebody with Lyme disease, you should be used to that. So it really depends on what the risk in your community is. So if you're in a community where there is a lot of incidence of the virus and it's out and about, you need to be more careful. If you're in an area where you're isolated anyway, you probably don't need to be as cautious. But then you also have to weigh that kind of where it is in your community versus your own risk tolerance, right? If you feel, you're somebody with Lyme disease, you had a long time, but you don't particularly get sick when the flu comes around, you're particularly feeling robust and you're more confident, then you may not need to be that worried about this virus coming around. On the other hand, if you've got Lyme disease and you're sick all the time, right, you catch everything that comes in, you definitely need to be a little bit more concerned. And again, also mixed in there is your own particular risk tolerance. Does that begin to answer your question?
Yeah.
Aurora? Yeah. Okay, I'm checking to see if anybody else has come in with a question yet. So if you do have a question about anything specific, prophylactic herbs, anything like that, your own strategy, if you've made a decision on how you're going to deal with this yourself, let us know here because we'd like to discuss that with everybody. Yeah, so Kimberly says she's never sick, even taking care of her kids with the flu. So I wish I had your immune system. That's kind of awesome. So Kim, are you worried about the virus then or not particularly? Why don't you let us know?
Yeah.
And Sam, I'm not sure what you're referring to here. 100% correct. Will only pay full lock. Are we talking about Lyme disease there? Or are we talking about something else? And so Kimberly says she is concerned about it because she has mast cell activation syndrome. Okay, well, that's a whole nother thing. And that's probably one reason why you don't get sick is because your immune system's so fired up all the time that it's killing off kind of everything all at the same time. So yeah, you want to definitely avoid things that are going to trigger the mast cell activation for sure, as you're well aware of that. I don't have to tell you anything more about that. Now, prophylactically, so here's the other thing about this virus. It's what they call a novel virus, right? So it's the novel coronavirus number 19, right? COVID is kind of what they're calling it on the news now. It's what all the techie scientists are calling it. So COVID-19 is a novel virus, which means it hasn't been through the human population yet. So that means nobody has immunity except for those few people in Italy and China and the rest of the world who already have this disease, right? So that means it's your innate immune response that's going to take care of this and fight it off in the beginning. You can't have the advantage of already having the disease and having your adaptive immune system take care of it, right? The memory B cells that'll create antibodies. So this is kind of like getting Lyme for the first time, and there are no antibodies on the test because the body hasn't made them yet. So the same thing with the coronavirus. When you first get it, there are not going to be any antibodies yet because the body has not seen this virus before. It's something brand new. So you want your innate immune system. And there are a couple things you can do to support that. So astragalus herbwise is one of the best known and one of the best things you could do. It supports the body's innate immune system. And there's another herb called perilla, which is also very good on the innate immune system side of things. And you want to make sure also that you kind of keep your vitamin C stores up. So however you do that, different people, some people can tolerate just ascorbic acid. Some people have to do something special like camu, various things like that. So however your vitamin C load is, you want to make sure that that is top notch. And there are a couple other things I'll get to, but I want to get to our questions here. So Paula says, boosting immune system when immune compromised, echinacea, elderberry, they're good until a cytokine cascade. So what do you exactly mean by a cytokine cascade? Because cytokines are being produced all the time by the body. So they're always cascading, but I think you mean something specific. And I'm not familiar with that term as a bad thing. So cytokines are always there.
So let's talk, how about instead, let's talk about it like if we had a mast cell activation, that things went into overdrive and we needed to calm things down.
Right. So part of the immune system is then the resolution phase as well, right? Mm-hmm. And so that's where mast cell activation, this is the other chronic illness comes in. And that's where things get complicated because you have multiple infections, let's say, going on, multiple irritants at the same time. And some of them may be endogenous, like gut dysbiosis or sensitivity to certain foods that you're eating, right, which can stimulate the immune system. So part of a healthy immune system is the resolution phase of it. But Aurora, it's too complicated to talk about the entire thing. But what I'm more interested now is focusing on the initial phase. But I think you're right, and I'm sure Paul will let us know that that's what you're talking about. So the immune system gets fired up, and then it calms down when you're healthy, right? Mm-hmm. Except as when we're not healthy, then it has trouble resolving. But interestingly enough, one of the things that needs to happen for the immune system to resolve is you have to have a strong enough nitric oxide response on the front end, on the innate side of things. So if the body doesn't produce a nitric oxide, it has trouble moving over into the resolution phase. And so the cytokines are expressed by the different immune cells, and like IL-10 is a resolution, but it's also resolution cytokine. Let me finish that phrase. But also, in order for the IL-10 to be expressed properly, you also need to have enough immunity in the beginning to do so. So it's this interesting dance, and you want to kind of trace it through one particular pathway, but it's more like the weather where there's all these different influences coming around. It's really tough to begin to get a hold. There's some basic things you can do, and all the anti-inflammatories. So that's the other thing, is a lot of people are on anti-inflammatories, which generally support the resolution of the immune system, but these anti-inflammatories can actually suppress the innate immune response and make you more vulnerable. And maybe that's one of the things we're finding happening with some of the older people that are getting sick with the virus.
Is that they're not able to generate that innate initial immune response?
Yeah.
Okay.
So Christine says she's got potential concern, just don't want to have to fight something else. Right. So in that case, you want to limit your exposure, right? You need to not go out as much. Maybe you want to stock up on some latex gloves or nitrile gloves if you're allergic to the latex, something like that to protect yourself. Definitely wash your hands frequently, right? Kim went ahead and doubled vitamin D dosage. That's interesting. I just learned recently about vitamin D, and if you have something like mast cell activation, doubling up on the D or taking a bunch of D initially may not be the best idea. So in general, if you're healthy, doubling up on and having enough vitamin D is critical for your immune response. But if you're already super inflamed and really tend toward the autoimmune side of things or mast cell activation, vitamin D may be causing more problems than it's helping. And it's pretty technical. I don't want to get into all the details there, but up to this point, I've been, everybody do D, more sunshine, more D. And for the first time, I'm kind of listening to those critics out there saying, there's a double-edged sword with vitamin D. Now, I'm not the people who say, don't take vitamin D ever. I'm not on that boat yet. I don't think I will be. But you have to be careful with the D, particularly if you already are inflamed. All right. Julie says, I think the previous question was about cytokine storms which can occur with acute infections. And that was Paula's. So a cytokine storm that's your immune system working. That's kind of like saying mast cell activation. So, the question is it working appropriately or not? So a cytokine storm is going to happen every time you're sick. And I think what we're talking about is unresolved inflammation. So that's the immune system producing too much of certain types of cytokines. And it's assumed, here's the big mistake people make. It's assumed that it's the inflammatory innate immune cytokines that are causing the problem. It's not always the case. There are cytokines like Th17 that get fired up, particularly when we're having immune type responses, autoimmune type responses. So it could be like a Th17 cytokine storm. It doesn't necessarily have to be the IL-6, IL-1, the TNF type responses that you see on the innate immune system. So the innate immune system is not necessarily a bad thing. I think it's gotten a bad rap. Macrophages are super important in this type of thing. And believe it or not, having enough nitric oxide on the innate immune system side of things actually helps the body move into the resolution phase and get the cytokine mix that's proper. And so the cytokines don't run out of control in one direction or the other. So some of the things you can do for nitric oxide, arginine is the substrate, but arginine isn't very well absorbed in the body and converted to nitric oxide. So probably the best supplement to support those levels is citrulline. So it's one of the things you can do if you're concerned about getting sick and want to make sure your innate immune system can respond properly, and your nitric oxide pathways in general, is to make sure you have enough citrulline on board. And you can dose that. There's some people who take up to 10 grams a day. You probably don't need that much. Somewhere between 1 and 5 is something to consider. Talk to your healthcare practitioner about, for sure. And so that could be a good thing to add in with your C. Okay. Paula says she's having brain fog. I know the feeling, Paula. All right. Interesting. So Beth O'Hara recommended vitamin D because it's low. Yeah. It's something that, depending on the community and your practitioner, I would definitely talk with Beth about it. She knows you much better than I do. So if Beth is suggesting you do it, I definitely respect her and would follow her instructions. And that's a good point to bring up here, that, at this point, I'm just some guy on Facebook. I do have a little bit of knowledge about this stuff, but if you have a practitioner, really the bottom line here is that's the person you should be having the main discussion with. This is for informational purposes only, help you get educated, help sort through some of the panic that's out there, because there's tons of emotion surrounding this right now. We had the discussion around the dinner table about how emotional this topic is. Can echinacea and elderberry cause your immune system become overactive? Paula, it's unlikely, right? They're not strong enough to push that hard. Now, that said, anybody can have an allergic reaction to anything, right? And we were talking a little bit about mast cell activation. So if you have an allergic reaction to either one of those, it can be problematic. But neither one of those is going to push your immune system, cause that much inflammation. You don't see that happen very often. But there's always one person out there, Aurora.
Yeah.
Julie said she just ordered some nitric oxide test strips and nitric oxide supplements and looking forward to see how that goes. Yeah, I'm a huge fan. Those of you who have heard me talk with at Bob Miller's conferences about nitric oxide, that I became a convert when I had my Lyme flare a couple years ago, and it's a fascinating molecule. And so, Julie, since you brought this up, let's get losing my ear things here. Let's clarify the strips. What they test for is something called nitrite. It's not actual nitric oxide. It's actually got two oxygen molecules attached to the nitrogen. And once the body's able to take away that one oxygen, then it becomes nitric oxide, NO. So nitrate's one step away from nitric oxide. So that's what the test strips are actually testing. And nitrite is made when the body makes nitric oxide, it reacts with hemoglobin, and some nitrate is made from that, nitrites and nitrates. But it's part of the body's recycling system, an alternative system to make nitric oxide. And so the food we eat, particularly green leafy vegetables, are very high in nitrates. And the nitrates hit your mouth, you chew them up, they get digested into the bloodstream, and then they come back and are concentrated in our saliva. And then there are little bacteria, good bacteria on the back of our tongues, and the saliva with the nitrates get converted into nitrite. We don't have an enzyme in the body that can take nitrate, which is 3 oxygen molecules. Am I confusing everybody yet, Aurora? It's got 3 oxygen molecules, and you take 1 oxygen off, and then you get the nitrite, which the test strips are testing for. And then you take 1 more oxygen off, and now you have nitric oxide. So we need these bacteria. So one thing that's interesting is a lot of people take harsh mouthwashes to help keep their mouth clean and free of bacteria, but that may be doing a bad thing in wiping out the good bacteria in the back of your mouth. So if you use the test strips and you find they don't turn dark purple, they're staying light pink or not even anything at all, one of the things to make sure is that you're not using a harsh mouthwash. So I like something like Biocide, and something herbal tends to spare the good bacteria and kill the bad. So Paula says she hears herbalists saying that, we're back to your question about echinacea and elderberry causing the system become overactive. And, in my experience, I haven't seen it. Now, I'm not saying that people haven't reacted badly to echinacea or elderberry, but, what can I say? I don't see that in my experience. I would not be afraid of taking it. Okay. So Aurora, do you? Yes.
I was going to say, going back to kind of the emotional response around the coronavirus, is there anything that you're seeing is complete hysteria? Like, how would you start to differentiate what you see as kind of a overly emotional response versus no, there's some legitimacy to this concern and the measures that are being taken?
So I'm glad you asked that question, particularly that way. And I'm going to punt on this question. And because it really goes to risk tolerance and the people making the decision or the person making the decision. So I think some of these, decisions that either seem to be under responsive, like they're not doing enough, or over responsive is like, oh my God, I can't believe they're doing that. I think it's at this point there's not enough information, so it's about risk mitigation, right? And risk, which is part of risk tolerance. So it's like when you go on your investing and your investing counselor says, "What's your tolerance for risk?" Like we know, right? Or do you have a lot of tolerance for risk, or do you like to play it safe? And so this is one of those questions, do you have a lot of risk tolerance, or do you like to play it safe? So many of these organizations are taking things and playing that very safe. For example, today I heard about some colleges who won't send their teams into New York, into upstate New York, where we are really pretty isolated. There's not been a case of coronavirus anywhere near us. But these teams will not send their sports team to play in central New York because the state of New York has declared a state of emergency. And so that's a very cautious response, right? They're going to isolate their team and not let them go into New York State. So that's based on their risk tolerance, which obviously is very, very low. They're being very cautious. The same with these schools who are canceling classes and telling their students not to come back after spring break. And there are a handful. Amherst has done that. Harvard has done that. Stanford had already done that a while back. Princeton. I think the list is growing kind of as it's becoming an accepted thing. And that's, again, very risk tolerance. Now, something interesting about the virus, in Japan, nobody under the age of 50, I'm forgetting now, it's either died or got the virus. And I apologize. That was on the CDC presentation today. And in Korea, the age was under 30. So this is a disease that's particularly affecting older people and people who are already really quite sick. And really, it's the combination of the two that causes the most problems. Now, one of the things I think that's interesting about this is one of the roots for the regular pneumonia virus that happens is people get the pneumonia virus in their upper respiratory, right? So they get it at the top of their mouth, they get it in their nose, and then you get the post-nasal drip, which we're also familiar to, right? So that all goes down into your stomach. Think about it, right? If you have good, young, strong stomach acid, everything gets killed off down there. Everything. If you don't, some of the things that went down the back of your throat into your stomach are going to survive. The other thing that happens if you tend to have weak stomach acid is you don't digest well, and so you have more gas, and so you're going to burp up. So now we've got live viruses in your stomach. You burp them up to the top, back down into your stomach, because that's what happens with the swallow reflex, is now they go down into your lungs, and all of a sudden you start having pneumonia cases break out. So this is one reason why the elderly are much, much more susceptible to pneumonia and the flu, and why it's so dangerous in a nursing home type of setting, and why they're so careful with those type of viruses all the time, not just with the coronavirus, but all the time. And I think that might be one of the things that's happening here, why the older people are more affected. For sure. And
because of the weak stomach.
Because of the weak stomach acid. So that's another thing you can do prophylactically, and probably should be doing anyways, to make sure you have good stomach acid. So there's lots of good protocols out there on the interwebs about hydrochloric acid, betaine HCl protocols to get your stomach acid back up. So I would also take a look at doing that. So Kim here says most of Ohio universities are closing several weeks all online. Yeah, it's just like it said, it's the risk tolerance. And so from one point of view, you're thinking, wait a minute, what does a university have in common with the nursing home and a lot of sick people? There are actually a lot of young people, right? Who are unlikely to get the disease, A, and then B, really unlikely to die. And so maybe there's some old sick professors, right? Or some staff members who are more at risk. But in general, that's not the population. But their risk tolerance is very low. So from their point of view, it makes a lot of sense to do this. Where from the outside, it said, wow, they're really overreacting. But again, the main prophylactic here, the main prevention measure you can take is to avoid contact with other people who have it. So based on your level of risk that you're willing to assume personally, that's how much contact. Now, the other interesting thing is like if you're, listening to this and you're in bed and you don't get out much, right? And people come to you, it's, and somebody's a little bit sick. It's like they should be probably avoiding you altogether. And if they do have to come, they should have the masks, right? It's not you that should have the mask. It's the people who are sick or spreading that should have the mask. So if you're healthy, you don't need a mask, even if you're out in public. Part of the panic that seems to be is like everybody wants to have a mask on. And in terms of preventing the spread, it doesn't seem to be particularly effective, according to the CDC. Now, that may change tomorrow if they come up with something new. But they also is like save the mask for the people who are sick and the people in hospitals. If the whole country, buys 100 masks, there won't be enough for the people who really, really need them. So that might be part of what the CDC is trying to manage there, is to make sure there are enough masks for the hospitals and the nursing homes where they really, truly need them. Yeah.
Yeah. And can I tell a quick anecdote about risk tolerance as well?
Yeah.
Okay. So a woman I was visiting with today had just gotten back from the hospital. She was hospitalized with the flu. She still has acute bronchitis, that sort of thing. And a cousin from Germany was coming to visit. And she made the decision today to call her daughter and her German cousin and say, listen, I am not healthy enough to visit you, and I'm not healthy enough to risk a possible infection from a coronavirus, which you might not have, but you also might have. So
yeah, and I think exactly. I think that's a perfect example of kind of the decision making that needs to happen. And again, your main point of contact in this should be your main healthcare practitioner. So if you have a Lyme doctor, that's the person you should be trying to get hold of and to figure out what your level of risk is. And Paula asks, is Lyme's we're at more risk than healthy population? And I would say in general, yes. I mean, one of the main functions, symptoms, problems with Lyme disease is that the immune dysfunction that comes along with it. So I would say in general, I would say yes. Somebody with chronic Lyme is most likely more susceptible. But again, you can kind of judge that, I think, by, do you get sick every year? Are you a type of person who gets sick, or has your immune system kind of reestablished its equilibrium? So I think that's, some of these, the infection, is it active? Is it going on? What's your immune system doing right now? So I think that's kind of where you have to take a look at that. So I'd say in general, Paula, yes, more at risk, but then it's an individual case. And again, it depends on how much exposure there is in your community. If you're in the middle of Chinatown where everybody's been traveling back and forth to China, in New York City or San Francisco or LA, maybe there's a reason to be more worried. If you have family who worked in the nursing home in Washington State and people were sick, if you went to the biotech conference in Boston, right, or have relatives who work there or family of people who went there, then you're more at risk, and you definitely want to take more active measures. But at this point in time, the CDC is not really taking global restrictive measures. That's going to be done really county by county. And so you need to be paying attention to what your local health people are saying. They have the most information and kind of taken all those things into account. That said, it's a personal decision. This is America. You get to make your own choices here. So Paula says, I think they're hoping to limit exposure all over to keep from overwhelming the healthcare system. Yeah, I'm sure that's part of it. There's big concern that it could just overwhelm our ability to hospitalize people who really need to be hospitalized. And then Paula says she does not get sick, but is that because my immune system is overactive? Well, Paula, that's an interesting discussion. I happen to know you a little bit, but I don't want to get into all the details live on Facebook, and then for what's it called, Aurora? Perpetuity, forever and ever. Forever and ever on our podcast. So we can have that discussion later on. In general, Paula, I would say in our interactions and knowing you a little bit, is that your immune system doesn't seem overactive to me. But maybe there are some things, there's some markers there. So there's some elevated white blood cells that are indicating that it is overactive. But I would say in general, no. All right, we're going to wrap this up soon. And Julie, you have the last word here. And Julie says, some say the reason a Lyme patient may not get sick often is because their immune system is shot. What do you think about this? I think this is a fascinating question. And I have my suspicions about that, right? So let me see. How do I want to say that? So definitely there's something called Th1 and Th2. So in general, this is a gross oversimplification. Those of you who know a lot about this will know I'm not telling you the whole story, but I'm keeping it simple so we can begin a discussion. So Th1 is basically aligned with the innate immune system, macrophages, neutrophils, I think natural killer cells too, but it's kind of the non-adaptive part of the immunity. Th2 is more the adaptive side, and also the resolution side. So the readings I've done seems to point that the infections from Lyme and co-infections push the immune system toward the Th2 side. So the Th1, this initial response to a new infection, isn't as robust. So yes, I have my suspicions. People say, oh, I never get sick, but they're not particularly healthy people. I actually have a suppressed immune response, right? Now, it's not as bad as somebody with AIDS who's like super sick, right? But it's not as robust as it could be. So that's where you find people with all these viral infections, right? The Lyme patient that has mono and has herpes, various herpes, and cytomegalovirus, all these other viruses that start to breed in the body because this normal innate immune system isn't able to go in there and really just hammer them down. This Th1 response is more specific to viral infections, and the Th2, larger infections, parasites, flukes, things like that. So I think it's a very, very interesting question, Julie, and I think you're right to be thinking in that direction, and that absolutely can happen. I have a couple patients of my own who I think that's one of the things going on. They say, oh, I never get sick, but they're never healthy either. Now, granted, if your immune system's completely shot, then it's going to be something very, very serious, like an AIDS patient, where the slightest thing can overwhelm the system. So it's an interesting question. I'm looking into it, and I hope you do too. All right. Actually, virus like Corona, yes, as opposed to viruses like the beer.
Dun-dun-dun.
All right. Dun-dun-dun. All right, everybody. Thank you for joining us. It's always a ton of fun to do these. If you like what we're doing, please share this information with your friends. Let them know we'll be doing this every Tuesday evening at 8 p.m. New York City time. So come along and meet up with us next week. We'll have another interesting topic. I think next week we're trying to line up a guest to talk about pain and what happens with pain syndrome. So it's going to be kind of a change of pace here. And today we're kind of impromptu. I had a guest lined up, but she wasn't feeling well, as happens often with people with Lyme disease. I'm sure you can understand. And so she bowed out at the last minute. But that's okay, because we got to talk to you about Lyme disease, and I had a ton of fun. So goodbye, everybody. We had fun. We'll see you next week, and we'll leave you with this.